Hello and welcome. Today we're diving deep into hemochromatosis, a digestive system disease characterized by excessive iron absorption and accumulation in the body. We'll explore its cause effects, diagnosis, and management strategies. So, let's get started on understanding this potentially serious condition. Hemochromatosis is primarily caused by genetic mutations that affect the body's ability to regulate iron absorption. The most common culprit is a mutation in the HFE gene, specifically the C282EY mutation. People who inherit two copies of this mutated gene are at higher risk of developing hemochromatosis. While genetic factors are the primary cause, acquired hemochromatosis can also occur due to conditions like chronic liver disease, blood transfusions, or iron overload from other sources. Now, let's understand the pathophysiology. In healthy individuals, the body tightly controls iron absorption from the diet. However, in hemochromatosis, this regulatory mechanism is faulty, leading to increased iron absorption in the small intestine. This excess iron is then transported to various organs, including the liver, heart, pancreas, and joints, where it accumulates over time. The iron accumulation causes oxidative stress and damages cells within these organs, eventually leading to organ dysfunction and disease. Hemochromatosis is the most common genetic disorder in Caucasians. It's estimated that around 1 in 200 to 1 in 400 people of Northern European descent are homozygous for the C282Y mutation, meaning they have two copies of the mutated gene. However, not everyone with the mutated gene will develop symptomatic hemochromatosis. The prevalence of clinical hemochromatosis, where symptoms are present, is lower, affecting roughly 1 in 2,000 to 1 in 10,000 individuals. The disease is less common in other ethnic groups. The signs and symptoms of hemochromatosis can vary widely depending on the amount of iron accumulated and the organs affected. Early symptoms are often vague and nonspecific, such as fatigue, joint pain, and abdominal pain. As the disease progresses, more specific symptoms may develop, including liver problems like cirrhosis, diabetes due to pancreatic damage, heart problems like cardiomyopathy, skin discoloration, often a bronze or grayish hue, erectile dysfunction in men, and menstrual irregularities in women. Because early symptoms can mimic other conditions, diagnosis can sometimes be delayed. Diagnosing hemochromatosis involves a combination of blood tests, genetic testing, and sometimes liver biopsy. Blood tests commonly used include serum iron, transferrin saturation, and ferritin levels. Elevated transferrin saturation, usually above 45%, and elevated ferritin, usually above normal range, are suggestive of iron overload. Genetic testing can identify the presence of HFE gene mutations, confirming the diagnosis. In some cases, a liver biopsy may be performed to assess the extent of liver damage and iron deposition. While we primarily discuss hereditary hemochromatosis, which is linked to the HFE gene, it's helpful to understand there are different types. Type 1, also known as classic hemochromatosis, is caused by mutations in the HFE gene. Types 2 through 4 are rarer and caused by mutations in other genes involved in iron regulation, such as hepcidin, hemojuvelin, and transferrin receptor 2. Knowing the specific type helps guide treatment strategies and assess the potential severity of the disease. The primary treatment for hemochromatosis is phlebotomy, also known as bloodletting. This involves regularly removing blood from the body to reduce iron stores. The frequency and amount of blood removed depend on the individual's iron levels and overall health. In some cases, chelation therapy, which uses medications to bind to iron and remove it from the body, may be used if phlebotomy is not feasible or tolerated. Additionally, managing any organ damage, such as diabetes or heart failure, is a crucial part of the treatment plan. Dietary modifications, such as avoiding iron-rich foods and vitamin C supplements, can also help to control iron levels. Unfortunately, there's no way to completely prevent hemochromatosis if you have the genetic predisposition. However, early diagnosis and treatment can prevent serious organ damage. Genetic screening for hemochromatosis is recommended for individuals with a family history of the condition. Avoiding excessive iron intake through supplements and fortified foods may also be beneficial, especially for individuals known to carry the HFE gene mutations. The prognosis for individuals with hemochromatosis is generally good if the condition is diagnosed and treated early. Regular phlebotomy can effectively control iron levels and prevent or reverse organ damage. However, if left untreated, hemochromatosis can lead to serious complications, including cirrhosis, liver cancer, heart failure, and diabetes. Recent research is focused on developing new therapies for hemochromatosis, including hepcidin analogs, which aim to regulate iron absorption more effectively. These advancements hold promise for improving the lives of individuals affected by this condition. Thank you for joining us for this overview of hemochromatosis.